Most blood pressure readings, even the ones taken in your doctor's office, are wrong. And that means millions of people are taking medication they may not actually need or missing a dangerous diagnosis entirely. This isn't happening because anyone is being careless. It's because blood pressure measurement looks simple. Cuff goes on, button gets pressed, number appears. But the American Heart Association's guidelines for accurate measurement include over a dozen specific conditions that need to be met. Most clinic visits don't allow time to explain them. Home monitor instructions barely mention them. Some millions of people are making decisions based on numbers that can be off by 10, 20, even 30 points without realizing why. Here's why that matters. Treatment decisions get made based on those numbers. If your readings are falsely high, you might end up on medication you don't actually need with side effects you'll have to manage. If they're falsely low, real hypertension goes undetected, quietly raising your risk of stroke, heart attack, and kidney damage over time. I'm going to walk you through 10 specific mistakes that cause inaccurate readings, why each one matters physiologically, and exactly how to fix it. Some of these seem small, but in clinical terms, they're the difference between accurate data and misleading numbers. Let's start with the one that affects almost everyone. Mistake number 1, not resting before measurement. The most common mistake is measuring right after physical activity or stress without giving your body time to settle. Here's why that's a problem. Any physical activity, even something as light as walking or climbing stairs, activates your sympathetic nervous system. That increases your heart rate and constricts your blood vessels. Blood pressure goes up, and that response doesn't stop the second you sit down. It takes about 5 minutes for your heart rate to normalize and 5 to 10 minutes for your blood vessels to fully relax. Studies show that if you measure within 5 minutes of moderate activity, your systolic pressure can be artificially elevated by 10 to 20 points. Diastolic by 5 to 10. If you're borderline, say, 135 systolic, that 15-point error could push you into a hypertension diagnosis that doesn't reflect your true resting state. The clinical consequence? Misclassification. You might get treated for high blood pressure you don't actually have at rest. Or your doctor sees much lower readings in the office and assumes it's white coat hypertension, missing a real problem. Here's the fix. Before you measure, sit quietly for at least 5 minutes. Don't talk. Don't check your phone. Don't do anything that requires focus or effort. Just sit. Use a timer if you need to. 5 minutes of complete stillness ensures the reading reflects your actual resting cardiovascular function, not leftover activation from what you were just doing. Mistake number 2, incorrect arm position. Second mistake, not positioning your arm at heart level. The mechanism here is gravity. Blood pressure is the force of blood pushing against your artery walls. When your arm hangs below your heart, gravity increases the column of blood in that artery, raising the measured pressure. When it's above your heart, the opposite happens. The error this introduces is significant. For every 10 centimeters your arm is below heart level, systolic pressure can increase by about 8 points. If your arm is hanging at your side, maybe 20 to 25 centimeters below your heart, that reading could be 15 to 20 points higher than reality. That number looks precise, but it isn't. The consequence? Overestimation. If you're already being treated and your arm is consistently too low, your doctor might increase your dose based on falsely elevated numbers. That can lead to overtreatment, dizziness, fatigue, blood pressure dropping too low when you stand. The fix is straightforward. Rest your arm on a flat surface at mid-chest level. The middle of the cuff should line up roughly with your heart. Don't hold your arm up. Muscle tension will also raise the reading. Support it. A table usually works. If you're in a chair without a table, use a cushion or pillow to bring your arm to the right height. Mistake number 3, talking or moving during measurement. A lot of people keep talking or shifting around while the cuff is inflating. Here's what that does. Speaking activates your diaphragm and chest muscles. It increases pressure inside your chest cavity and stimulates your sympathetic nervous system. Movement does the same thing. Even fidgeting. Both elevate your heart rate and vascular tone in the moment. The data on this is clear. Talking during measurement can raise systolic pressure by 10 to 15 points, and diastolic by 5 to 10. Shifting your weight or crossing your legs adds a few more. The consequence is noise. If you're tracking blood pressure over time to see if lifestyle changes or medications are working, inconsistent stillness creates variability that hides the real trend. The fix? Stay completely still and silent from the moment the cuff starts inflating until the reading finishes. If someone asks you a question, hold up your hand. You'll answer in a moment. This takes maybe 30 to 60 seconds. Treat it like a brief medical test. It requires focus, but only for a minute. If you're doing just one of these wrong, your readings may be off enough to change your diagnosis. And this next one is where a lot of home readings go wrong. Mistake number 4. Using the wrong cuff size. Using a cuff that doesn't match your arm circumference is one of the most overlooked problems. Here's the physiology. The cuff compresses your brachial artery until blood flow stops, then slowly releases while detecting when flow returns. If the cuff is too small, it doesn't distribute pressure evenly. It creates localized high pressure, and the reading comes out falsely high. If it's too large, it may not compress the artery, enough reading comes out falsely low. The error can be substantial. A cuff that's too small can overestimate systolic pressure by 10 to 40 points depending on how much of a mismatch there is. Too large typically underestimates by 5 to 10. The consequence is diagnostic error. If you have a larger arm and use a standard cuff, you could be diagnosed with hypertension when your pressure is actually normal. This is well documented. The American Heart Association says the cuff bladder should be about 40% of your arm circumference, and it should wrap around 80 to 100% of your arm. Most home monitors come with a standard cuff rated for arm circumferences between 22 and 32 centimeters, or 22 and 42. If you're outside that range, you need a different size. Here's what to do. Measure your arm circumference at the midpoint between your shoulder and elbow. Use a soft tape measure. Compare that number to the range printed on your cuff or listed in the manual. If you're outside the range, buy the correct size. Most manufacturers sell them separately. They're compatible with most automatic monitors. Mistake number 5. Not sitting with back supported and feet flat body position matters more than most people think. When you sit without back support, you engage your core muscles to stay upright. That increases abdominal pressure and sympathetic tone. When your feet dangle or you cross your legs, you change venous return from your lower body, which affects how much blood comes back to your heart, and that affects blood pressure. The numbers sitting without back support can raise systolic pressure by 5 to 10 points. Crossing your legs at the knee can add another 2 to 8. If you're borderline hypertensive, those small differences can shift you into a treatment category. The consequence is overdiagnosis or inconsistent data. If you measure with different postures each time, you're introducing variability that has nothing to do with your actual cardiovascular health. The fix? Sit in a chair with your back fully against the backrest. Both feet flat on the floor. Don't cross your legs. Don't sit on the edge. Don't lean forward. If your feet don't reach the floor, use a footstool. This standardizes the measurement and removes postural variables. According to the American Heart Association's 2017 guidelines, measurement technique matters as much as the device itself. These aren't optional tips. They're the conditions under which normal blood pressure ranges were established in the first place. If you don't follow them, you're comparing your numbers to a standard that was measured differently. Mistake number 6. Measuring on top of clothing. Many people put the cuff over a shirt or sweater to save time. The issue is interference. Fabric adds a layer between the cuff and your skin. It dampens pressure transmission and interferes with the sensor's ability to detect arterial pulsations accurately. Thick fabric is worse, but even thin cotton can introduce error. Studies show measuring over clothing can change readings by anywhere from 5 to 50 points, depending on the material. The variability is the real problem. You can't predict if it'll raise the number, lower it, or just distort it. The consequence? Unreliable data. If you sometimes measure over clothing and sometimes on bare skin, you're creating inconsistency that makes trends impossible to interpret. The fix is simple. Remove your arm from the sleeve or roll it up so the cuff sits on bare skin. Don't just push the sleeve up tight fabric bunched above the cuff. Acts like a tourniquet and changes blood flow. If you're wearing long sleeves, take your arm out of the sleeve completely. Mistake number 7, taking only one reading. A lot of people take a single measurement, write it down, and move on. Here's the context. Blood pressure fluctuates beat to beat. It varies with breathing, autonomic tone, and time of day. A single reading captures one snapshot. It may not represent your true average. The first reading is also often higher than the next ones because of something called the alerting response. Initial exposure to the cuff triggers a mild sympathetic reaction. Research shows the first reading is typically 5 to 10 points higher than the second or third. The American Heart Association recommends at least 2 readings, 1 minute apart, and averaging them. If you only take one measurement each time, you're likely recording consistently higher numbers than your actual resting pressure. Here's the fix. Take at least 2 readings, separated by 1 minute of rest. If they differ by more than 5 points, take a third. Then average them or record the lower of the two if they're close. This adds about 2 minutes to the process, but it significantly improves accuracy. And this next mistake is the reason many people are told their medication isn't working when it actually is. Mistake number 8. Measuring at inconsistent times of day. Blood pressure follows a daily pattern, and measuring at different times introduces variability you're not accounting for. The mechanism is circadian rhythm. Your autonomic nervous system and hormone levels change throughout the day. Blood pressure is lowest during sleep, rises sharply when you wake up, peaks mid-morning, dips slightly in the afternoon, and drops again at night. The difference between morning and evening can be 10 to 20 points or more. If you measure at 7 a.m. one day and 6 p.m. the next, you're comparing numbers from completely different points on your body's natural curve. That creates artificial variability that can be misinterpreted as instability or treatment failure. The consequence is confusion. If your doctor sees wildly variable home readings, they may question your monitor, your technique, or adjust medication based on noise rather than signal. The fix? Measure at the same time every day. The American Heart Association recommends mornings before medication and evenings before dinner. Consistency matters more than the specific time. What you're doing is sampling the same point in your daily rhythm so the numbers are actually comparable. Mistake number 9. Measuring after caffeine, nicotine, or alcohol. If you're measuring at home, this part matters more than you think. Consuming any of these shortly before measurement is extremely common and extremely distorting. Here's the physiology. Caffeine blocks adenosine receptors, which increases sympathetic activity and constricts blood vessels. Nicotine triggers the release of stress hormones that acutely raise heart rate and pressure. Alcohol has a two-phase effect, may lower pressure initially but causes rebound increases hours later. The impact is dose-dependent but significant. 1 cup of coffee can raise systolic pressure by 5 to 15 points for 1 to 3 hours. A cigarette can increase it by 5 to 10 points for 15 to 30 minutes. These effects peak within 30 to 60 minutes of consumption. The consequence? Falsely elevated readings that don't reflect your baseline. If you measure after your morning coffee every single day, your recorded pressure may be consistently higher than it would be without that acute stimulus. The American Heart Association recommends avoiding caffeine and nicotine for at least 30 minutes before measuring. For alcohol, wait several hours. Here's the fix. If you drink coffee in the morning, wait 30 to 60 minutes before you measure. If you smoke, delay the measurement. If you have alcohol with dinner, measure before you drink, not after. This requires planning, but it ensures the reading reflects resting physiology, not a chemical effect. Mistake number 10. Not validating your device. The final mistake is assuming your monitor stays accurate indefinitely. Automatic monitors use sensors that can drift out of calibration over time. Mechanical wear, battery changes, sensor degradation, all of these can throw off accuracy. Even high-quality devices can become inaccurate after a year or two of regular use. A study in the American Journal of Hypertension found that about 5 to 10% of home monitors tested were off by more than 10 points compared to manual measurement. In some cases, the error exceeded 20. The consequence is basing treatment on faulty data. If your monitor reads high and you increase medication in response, you risk overtreatment. If it reads low, you can miss worsening hypertension. Here's the fix. Validate your monitor against a clinical measurement at least once a year. Bring it to your doctor's appointment. Have your pressure measured with both devices within a few minutes, using proper technique for both. If the readings consistently differ by more than 5 points, your device may need recalibration or replacement. Also, choose a validated monitor. The American Heart Association maintains a list. Look for devices that meet ISO 80622 standards or have been validated by the European Society of Hypertension. To summarize, accurate blood pressure measurement requires more than pressing a button. Rest 5 minutes before measuring. Position your arm at heart level, supported. Stay still and silent during the reading. Use the correct cuff size. Sit with back and feet supported. Measure on bare skin. Take at least 2 readings and average them. Measure at the same time daily. Avoid caffeine, nicotine, and alcohol beforehand. Validate your device annually. These aren't suggestions. They're the conditions under which blood pressure standards were established. If you don't follow them, the numbers you're recording may not mean what you think they mean. If you're seeing consistently high or variable readings despite doing all of this correctly, that's worth discussing with your healthcare provider. Don't adjust medication on your own. Use the data to inform the conversation. If this was helpful, I've covered related topics including blood pressure variability and when home monitoring is more accurate than clinic measurements. Thanks for watching.